Here's a surprising fact. Over 2 million people in the United States are living with hepatitis C, and many don't even know it. It's known as a silent infection because it can live in your body for decades without showing any symptoms. But here's the good news. One simple blood test can tell you whether you've ever been exposed, and that could lead to treatment that literally saves your liver and your life. So what is the hepatitis C antibody test? How is it done? What do the results mean? And what do you do if it comes back positive? We'll answer all those questions and more in today's video. Let's dive in. Hepatitis C is a disease caused by the hepatitis C virus, or HCV. It primarily affects the liver and can cause inflammation, scarring, and over time, serious complications like cirrhosis, liver cancer, or even liver failure. It's transmitted through blood-to-blood contact, so things like sharing needles, unsterilized medical equipment, or a blood transfusion before 1992 can increase your risk. It can also be passed from mother to baby during childbirth, and in rare cases, through sexual contact. Here's the problem. Most people with hepatitis C don't feel sick right away. In fact, you could have it for 20 years or more without knowing. That's why testing is so important. It gives you a chance to act before serious damage is done. Now let's talk about the hepatitis C antibody test, also called the anti-HCV test. This is the first step in diagnosing a hepatitis C infection. The test looks for antibodies to the hepatitis C virus. These are special proteins your immune system creates to fight off the virus. If you've ever been exposed to hepatitis C, even if it was years ago, your body will likely have made these antibodies, and this test will pick them up. Important note, this test doesn't detect the virus itself, just the antibodies. So it tells you that you've been exposed, not necessarily that you still have an active infection. That's why the next step is so important. If the antibody test is positive, a second test is needed. If your hepatitis C antibody test comes back positive, don't panic. That just means your body has been exposed to the virus at some point. Next, your doctor will order an HCV RNA test, also known as a PCR test. This test looks directly for the genetic material of the virus in your blood. If that test is negative, it means you were exposed in the past, but your body cleared the infection on its own, something that happens in about 15 to 25% of people. But if the RNA test is positive, it means the virus is still in your system, and you have a chronic hepatitis C infection, which requires treatment. So, who should take this test? The short answer is almost everyone. The CDC recommends that all adults over 18 years old get tested at least once in their lives. And if you're in a high-risk group, you may need to get tested more than once. You're especially encouraged to get tested if you were born between 1945 and 1965, you've ever used injection drugs, you received a blood transfusion or organ transplant before 1992, you're living with HIV, you've been exposed to blood at work, like in healthcare settings, you've been on long-term dialysis, or you were born to a mother with hepatitis C. Even if you feel perfectly fine, the test could give you peace of mind or a head start on getting the treatment you need. The test itself is very simple. It's done using a standard blood draw, just like any other lab test. You don't need to fast or do anything special beforehand. Your doctor might order the test as part of a routine screening, or you can request it yourself if you think you may be at risk. Many community health centers, public clinics, and even mobile units offer it for free or low cost if you don't have insurance. If your test results confirm that you do have chronic hepatitis C, try not to worry. Treatment today is highly effective and much easier than it used to be. Modern medications called direct-acting antivirals, or DAAs, can cure hepatitis C in over 95% of cases, Most people take one pill a day for 8 to 12 weeks with minimal side effects. And once you're cured, you're no longer infectious and you're protected from future liver damage. It's truly one of the biggest success stories in medicine in recent years. The hepatitis C antibody test is a critical first step. It gives you the information you need to take control of your health. Whether your result is negative or positive, you'll be better off knowing. And remember, hepatitis C is preventable. If you're at risk, don't share needles or personal hygiene items like razors. Practice safe sex. Make sure any tattoos or piercings are done in licensed, sterile environments. And get regular screenings if your risk is ongoing.
Thanks for watching. If you found this video helpful, give it a thumbs up and subscribe for more health content like this. And if you have any questions about hepatitis C, the testing process, or anything we cover today, drop them in the comments below. We're here to help and happy to answer. Your health matters. A simple test could make all the difference. So take charge and stay informed. See you next time.